Hi, I'm Dr. Rudi Moerck, and I'm here today to talk about some recent news that has been on the New York Times, CNN, and other news media outlets about vitamins. And the point of view that was taken was that they are a waste of money. And I'm here today to talk about the fact that they're not a waste of money and that the pharmaceutical industry and pharmacists are very biased when it comes to the taking of supplements, and they are trying to propagandize this discussion in an extreme way. Now, my company, Valensa, is a human health company. We're not a pharmaceutical company, we're not a supplement company, we're not a company that treats patients or cures diseases. We are a human health company. We have a viewpoint, and we believe that pharmaceuticals, supplements, food, and exercises are the keys to good human health in the proper proportions and with reasonable approaches. Do supplements have a place in that? Absolutely, because you need to analyze your exercise, your lifestyle, and the food that you take in and see if there's some missing pieces that could be supplemented in order to bring it up to what we would consider, or the well-trained person in this area would consider, a good diet and a good level of nutrients in your body. And which nutrients are essential? Vitamin C. Everybody should be taking vitamin C. Oh, but you get it from orange juice, right? Well, no, that's not a good way to get vitamin C. Good way to get vitamin C is from a supplement that doesn't have any sugar in it, like orange juice. Please enjoy your small glass of orange juice or grapefruit juice in the morning, but remember, it has a lot of sugar in it, which is not good for your health. Also, the B vitamins are very important, especially B12, because of potential nerve damage if you don't have enough of it in your diet. So I recommend supplementing with individual doses of B2, B6, and B12. B12 is very important, especially in people that are vegetarians. Also, it is absolutely necessary and essential to have ALA in your diet, the omega-3 called ALA, the one that comes from plants like flax, chia, and perilla. If you do not have at least 1.3 grams of ALA in your body every day, you will die. That is a statement from the Institute of Medicine, a subsidiary of the Food and Drug Administration. Now, ALA can be converted to EPA and DHA in your body. The fish oil people say the conversion is very slow. I say the conversion is on demand. People that have never eaten fish, have never taken a fish oil supplement, have as much DHA in your brain, in their brains and in their bodies, as people that eat fish and have fish oil supplements. I also think it is necessary to take D3 every day because of our lifestyles. We don't work out in the fields. We don't get a lot of sun exposure. If you choose to get more sun exposure, please be careful about sun exposure to your face. The pharmaceutical industry is categorizing all supplements in one giant basket, and there's very little education in medical schools for doctors about the value of certain supplements. And also, some of these supplements are very important, and I highly recommend taking, for instance, if you're not allergic to shellfish, krill oil every day, 300 milligrams a day. It contains astaxanthin. I also recommend taking an astaxanthin supplement because you can't get that from any food you eat except for wild salmon, not farm-raised salmon. I also recommend taking CoQ10, especially if you're on statins. Pharmaceutical industry does not promote things like CoQ10, even though they know that if you take statins to reduce cholesterol, you will have depleted CoQ10 in your body, and that could be one of the reasons why you see some of the side effects of taking statins, like cramping of muscles or muscle ache or joint aches. And in the nutraceutical industry, this is well known, and I highly recommend to do that. I also recommend taking lutein for eyesight, lycopene for prostate health, breast health, and heart health, and spirulina, which contains a water-soluble antioxidant called phycocyanin. Also contains a lot of protein, also contains certain B nutrients and carotenoids. I also recommend taking less fat every day, reducing your fat consumption. The vitamins that I would recommend minimizing and avoiding sometimes are vitamin E. There's lots of vitamin E in your diet because all the food that you eat, most of the food you eat is processed food. It contains vitamin E to increase the shelf life. I also recommend being very careful with minerals. I also recommend reducing your intake of fat and sugar. I also believe that there are certain categories of supplements which you should take a very hard look at, and sometimes you need to avoid them. Things like fat burners or diet pills are generally not effective, and in certain cases can be dangerous if taken to excess amounts. For example, fat burners that contain chromium, selenium, and other heavy metals taken in excess can be toxic. But again, people in this nutraceutical industry know this. Take a dose that makes sense. I personally avoid minerals in my supplement regimen because all the food I eat has a lot of minerals in it. I eat a lot of greens. I eat a lot of good, healthy grass-fed beef. Not a lot of it, but a modest amount of it. And therefore, I think I'm getting the minerals and vitamins I need to that, from that. So therefore, I take a one-a-day type of vitamin without minerals. I avoid taking any other mineral supplements. And I believe that a sensible approach by the pharmaceutical industry, making it complementary with supplements, pharmacists, hospitals need to realize that there's a certain base load of supplements that are extremely important, very useful in the human diet. And there are some that are questionable because you're trying to reverse things, bad decisions, or reverse diet choices that you've made that are detrimental to health. The pharmaceutical industry does not know what it's talking about when it's talking about supplements. Careful analysis of supplements will point out certain essential supplements that you should be taking: vitamin C, B2, B12, ALA, the omega-3 ALA. Do take D3. I also recommend CoQ10. I recommend taking spirulina and krill oil. And all those things you can take when you go to the hospital. There's no problem. The only one you should avoid before surgery is ALA because it has a tendency to reduce clotting. But in some persons, reduced clotting, of course, is a good thing. Talk to your doctor and find a doctor that understands supplements and is willing to work with you to have yourself have a good diet, the proper food, the proper pharmaceuticals, the proper supplements, and the proper exercise program to improve your life. Thank you very much. This is Dr. Rudi Moerck.